Welcome back. We're following through tonight on a story we first brought you here yesterday on an executive order looking to restrict gender-affirming care for minors.
Yeah, and tonight we're hearing the voice of people worried about what this could mean for people in the LGBTQ+ community. ABC Action News reporter Mary O'Connell listened to parents, doctors, and Florida organizations on the impact and ripple effect.
As a parent, looking out for your children is always your top priority. That's certainly true for Dr. Robin Hauser, who's a general pediatrician. She also has a transgender daughter.
It wasn't something that my husband and I took lightly. We looked to the specialists, we had therapists, we made sure that we did everything correctly, so that ultimately my child was happy and healthy.
Now, worry for some families with a recent executive order regarding gender-affirming care. The order says it's the policy of the United States that it won't, quote, fund, sponsor, promote, assist, or support the transition of a child from one sex to another, and that it will enforce all laws that, quote, prohibit or limit these procedures. It defines children as people under 19 and refers to care like puberty blockers, hormone therapies, and surgeries.
I have a child that's transgender that's doing so much better. In the past 3 years since she's received gender-affirming care, she's now a sophomore in college and doing great in school and has her group of friends, and it's just night and day difference. I have my kid back. And as a mom, that's all you want for your child.
I spoke with Jennifer Solomon with Equality Florida, who says at the end of the day, it should be left to a patient, their family, and their healthcare professionals.
You know, the suicide rate for our children is extremely high, and we know by providing gender-affirming care from all the major medical associations that say this is life-saving care.
Dr. Hauser thinks there's lots of misinformation out there too.
So we have some kids that go through puberty prematurely, and in order for them to we want to slow down their growth so they meet their adult height and they're healthy. We actually give them puberty blockers to slow down that puberty so they're able to grow and reach their adult height. So if we can do that in them safely, we can certainly do that in transgender individuals safely.
A community sharing their voice as families wait for what comes next.
And I think as human beings, we need to be ultimately allowed to be who we are.
Equality Florida also wants people to know they have resources available to families like their program Parenting with Pride. We'll have more information on our website, abcactionnews.com. In Tampa, Mary O'Connell, ABC Action News.